This segment is sponsored by Capital Caring. For nearly 50 years, Capital Caring has made an impact in the DMV.
That's right. No matter your age, race, religion, or gender, Capital Caring provides hospice and bereavement care to anyone and their family. So here to share more about their hard work is Steve Cohn, Chief of Communications, Marketing, and Philanthropy. Good to have you back.
Always good to see
Thanks
you.
Thanks to you both for having me as we approach our 48th year of continuous care in the Washington metro area.
Congrats.
And you kind of got it started here, right?
Yeah, I mean, Capital Caring Health was one of the original 10 hospice organizations in the nation that started operation in 1977, even before the legislation was passed a few years later.
Wow.
So we have a long history of providing hospice and palliative care, as you guys mentioned, for anyone, including people who aren't even citizens.
Okay.
And if people don't have insurance, we cover that thanks to philanthropy. So no one ever gets a bill for hospice care. There's a misconception that hospice costs money. It doesn't. It's free.
Wow.
So
has your mission always been the same since day one, or has it changed over the years?
It has, but the point on over the years is the need gets greater because there are more older people, thanks to the baby boomers. I'm one of them. So we perceive that the need for our services will increase every year that we can see in the future, and we want to be prepared for that. And so one of the situations that we're facing, which is a national issue, is a nursing shortage. So we're always looking for RNs to join us and become part of our family.
I mean, nurses always have that bedside manner. They'd have to know how to react with patients and comfort them. But what do you look for in an RN?
Well, we're looking for someone that really wants to become part of a family where we're caring for the loved one who's terminally ill. Because most of hospice care is provided in the home. So you literally become part of the family for the period of time that you're providing the care, which hopefully is weeks and months, not just days. And another thing we want people to understand is the sooner you enter hospice care, the longer, most likely you will live longer, feel better, and everyone's happier.
Because
The
you're not
patient
in
as
the
well as the
hospital.
family. You're not in the hospital. Hospitals do a great job, but they're not suited for terminally ill folks who really feel better at home. We can care for them at home. And we provide a lot of assistance through that journey with the family members as well. And hospitals don't do that. That's not what their role is.
I would imagine that's a special calling for some nurses to be there with the families. This is an incredibly difficult
That's right.
time.
It's really a one-on-one experience. It's not taking care of 70 patients at a time. It's taking
Are the
care
hours different too?
Well, no, not really.
Okay.
But our nurses sometimes want to be there even if it's not part of their shift, because they can tell when a patient really needs end-of-life assistance. So,
What's it like for you, Steve, being a part of Capital Caring and getting responses from families? And you know, you're in charge of philanthropy, so I know you're hearing these stories all the time.
well, I always hear your staff are angels. The doctors, the nurses, the social workers, the chaplains, and our volunteers. I hear that a lot. They're angels, and we couldn't have lived through this period without them. And that's a tragedy when people don't enroll in our hospice care and they go it alone. There's no reason for that, and the stress on the family is tremendous if there is a family. And our volunteers also become part of the family, especially if it's just a person with no family around here. So we really do customize the treatment based upon the patient's situation.
And we've talked about hospice care real fast. You have free bereavement counseling as well, right, when they do pass?
Yes, and that's often cited as the best benefit of the whole experience is that we provide one-on-one counseling or family group counseling for as long as necessary, completely free.
It's amazing.
And also for the whole community. So you don't need to have a patient relationship with us. Anyone living in the DMV will counsel.
Steve, thank you.
Thank you so
much. And all the work you all do.
Yes. If your family maybe is in need of hospice or palliative care, you can head to capitalcaring.org. And if you're a registered nurse or a social worker who is interested in working with Capital Care, you can head to capitalcaring.org, or you can call. There's a number too, 703-351-2817. Again, it's 703-351-2817.